folks, it's David at TED-IELTS, and today I want to teach you some vocabulary related to hospitals. To do that, I'm going to divide this video into chapters, with each chapter focusing on a particular theme. We'll look at different parts of a hospital, the people you'll find in a hospital, and some verbs you might want to use when talking about hospitals. You might find it useful to jump backwards and forwards using the timeline below. By the way, this video will mostly be providing vocabulary for people whose level is intermediate or higher, so I'll skip over the really basic stuff such as doctor and nurse and medicine, assuming that everyone already knows it. Okay, let's begin with the various parts of a hospital, and just to make this easier for those of you who are making notes at home, I'm going to go through these alphabetically. First of all, we have the emergency room, which is often abbreviated to ER. This is where people are taken when they've had a serious accident and need immediate medical attention. Next, we have the intensive care unit, or ICU. This is also part of the hospital where people who are seriously sick or injured will be taken, but this is different from the emergency room. The emergency room is where you will first be taken when you arrive because you need immediate medical treatment. But the ICU is for people who need to be closely monitored and given specialized care due to their condition being very serious. So this might happen later or over a longer time. Laboratories are rooms specially designed for scientific experiments and processes. These will include specialist equipment such as microscopes, which we can see in this picture here. In a hospital, these rooms are usually used for conducting tests such as examining blood samples. A maternity ward is for women who are going to give birth or who have recently given birth. Basically, it's the part of the hospital dedicated to the process of women having babies. Pregnant women might go there for checkups, they might give birth there and then stay there after giving birth. It's also where babies will be looked after in the first hours or even days of their lives. An operating room or operating theater is where operations take place. That means when someone goes through a surgical procedure. These rooms are designed so that they are particularly clean to avoid infections, and surgeons have access to all the necessary equipment they need for operations. Next, we have the oncology department. Oncology is an area of medicine that focuses on the study, diagnosis, treatment, and prevention of cancer. So in this department, pretty much everything is set up to deal with various types of cancer. While we're on this topic, let's note that there are many departments in hospitals and that these have different purposes. There is radiology, gynecology, neurology, cardiology, and so on. You'll have noticed what I said there. Each of those words ended in ology because that's a suffix that finishes different types of sciences, basically. And in a hospital, you'll often see a department and then the word before it will be something that says ology. Pediatric units are specially designed to look after children. Everything here is designed to help children who are ill or help them to grow in a healthy way. So I'm from the UK, but if you prefer American English, then please note the spelling is different here. In the UK, we say P-A-E-D, but in American English, it's just P-E-D. Right, next we have the pharmacy. You can find these in towns and cities, of course, but in hospitals, usually there's a pharmacy as well. And this is where medications are prepared and dispensed. If your doctor tells you that you need some kind of medicine, you'll have to go to the pharmacy to collect it. Finally, we come to the waiting room. As this name suggests, and I think you could probably guess what this means, it's a room for waiting in. Often when you see a doctor or nurse, you'll have to sit and wait for a while. So sometimes that can be a long time, and you'll do this in the waiting room. Also, if someone is with you and you go to see a doctor, then they might have to wait for you in that waiting room or another waiting room. Okay, so that's all for the first part of this video. Obviously, there are many more parts of a hospital that I haven't mentioned here. There just are too many to list. You can easily research those by looking at hospitals on Google and seeing the various departments they include. What we're going to do now is move on to the people you'll find in a hospital. And first of all, you'll probably encounter administrative staff. These people handle the running of a hospital by dealing with documents, appointments, and so on. Cardiologists are doctors who specialize in the diagnosis and treatment of heart and blood vessel conditions. You'll find them working in the cardiology department, which we mentioned in the previous section. You may remember that suffix ology. Well, a person who specializes in an ology subject takes the suffix ologist. So cardiology becomes cardiologist, neurology becomes neurologist, gynecology becomes gynecologist, and so on. Maintenance personnel are the people who keep a hospital clean. These include cleaning staff, like janitors. Medical technicians assist in various diagnostic procedures such as x-rays, ultrasounds, and laboratory tests. They might collect, organize, test, and store medical specimens, for example. Midwives are people who help women give birth and then look after the baby. Note that one person is called a midwife and more than one are midwives. Next, we have occupational therapists. These are people who evaluate and treat patients who have injuries, illnesses, or disabilities. They help them to develop, recover, improve, and maintain the skills needed for daily living and working. Paramedics actually do most of their work outside of a hospital, but I'll mention them here because the hospital is sort of their base and they'll work in an ambulance to bring people to the hospital for treatment. These people function in an emergency response and they will have to keep people alive until they get to the hospital for proper treatment. Pediatricians are doctors who specialize in children. Earlier, we learned the phrase pediatric unit, and these are precisely the people you will find working there. Physical therapists help people to recover from injuries. They focus on movement and can help people to do exercises to regain their physical health. For example, if you had a very serious injury and you were not able to walk, these are the people that might help you learn how to walk again. Radiologists specialize in diagnosing and treating injuries and diseases using medical imaging and procedures, including X-rays and MRIs. Okay, that's all for the people who work in a hospital, but did you notice that almost all of them wore similar clothes? The clothes that doctors and nurses normally wear in hospitals are called scrubs. Finally, let's look at a few verbs you might need when talking about a hospital. The first is admit, which refers to allowing someone into a certain part of the hospital. A patient might be admitted to the ICU, for example. Consult means to talk with an expert. If you have a skin problem, you may consult with a dermatologist. The word diagnose is one we've seen a few times today already. It means to figure out a health problem. The word discharge means to let a patient leave. So if your health problem is fixed or you are well enough to go home, you will be discharged from the hospital. The pharmacists at a hospital dispense medication if you have a prescription for it. Meanwhile, surgeons will operate on people. We saw physical therapists in the last section. Well, these help to rehabilitate patients. The word treat in this context means a doctor or nurse will try to help someone. And triage means when the staff of a hospital determine how serious someone's condition is in order to admit them. The most serious ones usually go first and the least serious ones are admitted later. Okay, so that's all for today. It's been a long time since my last video, so hopefully you appreciated this one. And if you did, please give it a like, and that'll let me know whether to keep on making more videos like this. And feel free to leave a comment if you have any suggestions about what those future videos should be. Aside from that, I wish you good luck with your English learning journey, and until next time, goodbye.